Hi everyone, welcome again to my channel, Special Parents for Special Children. The purpose of this video is to promote awareness and encourage parents and caregivers to actively engage, interact, and understand children with special needs. So let's review first what we have discussed on our previous video. All right, so again, to review, autism or autism spectrum disorder is a developmental disorder that can be detected or appear within the first 3 years of life. So currently, the diagnostic name for um, autism is now autism spectrum disorder. That means that each individual that is diagnosed with ASD experience their own unique strengths, symptoms, and challenges. All right. So there are three things, or there are three aspects in life that could be affected by ASD. So first would be social communication and interaction skill. So because of the difference in brain functioning, individuals with ASD may have some challenges in establishing social communication and also interaction skills. And we may have noticed also, even at a young age, that children that are diagnosed or manifesting ASD have behaviors or interests that are atypical or unusual compared to typical children. So, what are these? So, we're looking at repetitive behavior or restrictive behavior. So, we can see the rocking back and forth. We do spinning in place, and the most common is hand flapping. And also, there are kids that would also manifest tiptoeing or magkinto sila when they are walking, and they are very focused on routines. So they have established routines that when it's changed, then it may cause some behavior problem. Okay, and elevated sensitivity towards sound, texture, taste. So the senses are high, so they could be very sensitive to a single sound or a single texture. So we're looking at, they don't want to eat this type of food because maybe it's the texture, maybe it's the smell of that food that they don't like, that they are sensitive. So we need to understand also why they don't eat this particular kind of food, or they are very reactive to certain noises or sounds. And sometimes we also notice the repetitive, or they repeat words or phrases that is known as echolalia. So you may have noticed that they may repeat what you are saying, or sometimes they also repeat phrases or dialogues from their favorite video or movies. And then the third one is the developmental delays. So we would have characteristics, we might see characteristics and developmental delays physically, or some would be the language and speech skills that are delayed. So the delay in speech and communication skills, also cognition and acquisition, or learning skills, or learning things that we're teaching them at home, medyo delayed sila. Medyo they would need constant reminder or repetition before they would understand or they would learn the task. So it is very important to know that children with ASD may have a delayed cognition or may have challenges in acquiring knowledge or understanding instruction. And also, some children may also demonstrate hyperactivity or impulsiveness. So, what are we talking about? Why are we talking about hyperactivity? So, they might have extra energy. They're energetic, and also they are very reactive. So, they respond quickly into something. Um, so these are some of the indications that children may manifest that could lead into a diagnosis of autistic spectrum disorder or autism spectrum disorder. All right, so moving forward, this part of the video, we will be exploring possibilities. So, what are and then how we build those foundations. So we're looking at diagnosis. Why is early intervention? Why is diagnosis at an early age important? All right, so very big question. This is has been a question since then and until now. Is there a cure for autism spectrum disorder? May gamot ba to heal or to cure autism spectrum disorder? So let's look at two sources. First would be the U.S. Department of Health and Human Services. Um, it entails that currently, as of this time, there is no medication that can cure autism spectrum disorder or ASD and all of its symptoms. So, those symptoms that we have discussed from the previous slides, developmental delays, we have social skills challenges. Um, there is no cure for that. There is no one medicine that will cure all of those. So there is, according to U.S. Department of Health and Human Services, wala pong gamot laban sa ASD. And then looking into the National Health Services, autism is where your brain develops differently to compared to non-autistic people or typical people. It is not an illness and there is no cure. So hindi po ito sakit. ASD or autism is not a disease. So therefore, it doesn't need medication or there is no cure. So then, what can we do? How can we help? How can we intervene if a person or a child is diagnosed with ASD? Now, here comes where we talked about why is it important. So let's review the factors that may lead us to formal diagnosis. So, autism is not a disease to be cured. Hindi po ito sakit. This is a lifelong neurodevelopmental, meaning it um, involves brain functioning, it involves um, neurodevelopment, and that may be a lifelong challenge on how people interacts with the world. And this is not an illness that can be cured. And it is very important that early intervention and ongoing support begins as early as 3 years old. Early intervention and continued support can significantly improve individuals' quality of life and help them develop important skills like communication and social interaction, as well as daily living skills. So, what does that mean? So, there is no cure, but there are things that we can do in order to help these symptoms. So, and also to make them more independent, make them more responsive to the world. So the important skills would be in the area of communication, social interaction, and also daily living skills. So daily living skills are yung pag-aaruga sa sarili or how to take care of themselves. So let's encourage them to be independent and taking care of themselves and also expressing their wants, their needs, and also their feelings. And how do we do that? So to intervene is to focus on their strengths and individual needs. So let's identify what are their strengths. Ano ba ang hilig nila? What do they focus on? And then let's look at what are the needs. So what are the challenges that they are manifesting as of now? So ito yung intervention. We focus on identifying and building upon the individual's unique strengths and addressing their specific challenges. So, in our upcoming videos, we're going to focus on how to help these children develop skills to improve their quality of life from from young until adulthood. Okay, so what can we do to help them, or how we focus on identifying their strengths? Ano ba ang magaling sila? And then we build it from there. We build the skill, we build skill acquisition and the teaching towards where they are interested, and then address specific challenges as well. And then positive outcomes are possible. So there is no cure, but there are positive outcomes, and they are very possible. So, with appropriate therapies and support, individuals with ASD can make meaningful progress and achieve greater independence. So, in summary, there is no cure for autism. There is no one medicine that cures all the symptoms of ASD. But there are various interventions and support that can help individuals that are diagnosed or manifesting ASD tendencies to thrive and reach their full potentials. All right, so we're talking about early intervention. We're talking about ongoing support to improve their quality of life. We're talking about focusing on their strength and their abilities to teach skills. And then also, we talk about therapies and professional services. So, how can we establish this? How can we establish these needs? So, here comes the very important part of once they reach the age of 3 or even younger. Early screening for autism spectrum disorder is recommended. And from my own experience as a teacher, as a caregiver, early detection, early diagnosis is very important. Why? So, early identification of developmental disorder um, can is an integral function of a um, primary care or a pediatric doctor or pediatric healthcare professional. So sila yung mag-a-assist. So um, as we all know, pagbata, there are schedules to visit their doctors. So as part of those visits, these pediatrician also checks for signs of um, developmental disorder? Are there delays that are expected? If they are 1 year old, they're 2 years old, they're 3 years old. And also, from the American Academy of Pediatrics, they recommend that children be screened for developmental delays and also disabilities during their regular doctor visit as early as 9 months. And then another screening would be at 18 months and then 30 months. All children should be screened specifically for autism spectrum disorder during a well child doctor visit in 18 months and 24 months. So this is now a recommendation. So dito sa Amerika, it is now mandatory for pediatrician to check, to screen specific tendencies of all children during their 18 months visit and also 24 months visit. So 1.5 year old, and then another screening would come at 24 months or at 2 years old. All right. So now that the child is screened, may suspecha po tayo na nagmanifest siya ng ASD. So what are the research-based intervention following the diagnosis? So what can we expect? How can we provide and how can we intervene um, following the diagnosis of ASD? So we have behavioral approaches. So first, we shape the behavior. Um, Shaping behaviors by understanding what happens before and after the behavior. So this is called one example for this is applied behavior analysis. So we will focus on applied behavior analysis in one of our videos. So we will study the research based or the evidence based behavior modification. And then how can we use this at home? So we're not scientists, we're not merely professionals that are experienced in this ABA approach, but we can take that theory and we can use that theory in building skills and modifying behaviors at home. Also, developmental skills. So um, developmental approaches, they focus into speech and language therapy, if they need occupational therapy, and also physical therapy. So ito yung mga uh, possible interventions after the diagnosis. Educational. So once a child is diagnosed with ASD, of course, education is an integral part of it. So, for example, the provision of special education, which in that special education, meron po tayong tinatawag na IEP or Individual Education Plan. And also, then we'll establish learning support as well as academic modification and accommodations. So, importante din po that at a very young age, when a child is diagnosed with ASD, that we tailor, we adjust, we modify um, uh, the curriculum or the teaching to address their needs and also to build skills from their interest. And then social emotional. Social emotional, ito po yung uh, uh, pointing out yung social skills building, as well as interaction, emotional bonds. So example would be social skills group or individual instruction. It could also be counseling, focusing on special skills. Pharmacological. So hindi po ito common since autism is not a disease, so there is no cure, there is no medicine. So when we talk about pharmacological, ito po yung mga prescription medication that may address the symptoms, not ASD, but the symptoms of ASD. So what are those symptoms? So we have hyperactivity, inability to focus, uh, and then behavior issues like self-harming. Ito yung that will harm themselves or put themselves in danger. So ito yung maa-address ng pharmacological. So not autism itself, where there is no cure for autism, but there are some medication that may help decrease the symptoms. So, for example, decrease the symptoms of hyperactivity, decrease the symptoms of self-injurious behavior, yung sinasaktan nila ang sarili nila, or they could be very aggressive to others. That could they become harm to themselves and others. And then psychological, which is very important. So, as the child grows into adulthood, as a teenager, they may experience help in coping, anxiety, depression, and other mental health issues. So, these are addressed psychologically. So, you could be, the child can be referred to a psychologist for counseling and cognitive behavior therapies. So these are the interventions that will follow that your doctor may suggest after the diagnosis of ASD. So let me stress that hindi po ito marerecommend ng doktor or ng professional unless the child is diagnosed with ASD. Kasi po, this is going to be your support network. It could be all of these, or it could be some of this, depending on the assessment by the pediatrician or other health professional that are authorized to diagnose ASD. All right, so now going into the Philippines, according to my research, I am really happy that there is actually a law that is now a Republic Act that address autism or ASD. So it is Republic Act 10754. So ano po itong Republic Act 10754? This is called the Autism Cares Act of the Philippines. So, the summary of this Republic Act is it mandates on providing services and intervention programs for individual with autism. And it also promotes the rights and welfare of individuals with autism, ensuring that they are included and also given equal opportunities. So, what does that mean? All right, so CARES. So ito po ay acronym. Autism Cooperation, Accountability, Research, Evaluation, and Support. So that is CARES Act or Autism CARES Act of 2022, now Republic Act 10754. All right, so to continue, I will just pick the sections that are very important in this Republic Act. So, Section 4, it mandates a treatment as persons with disabilities. So, we have the PWD, Republic Act 7277, about PWD or persons with disability. So now, Republic Act 10754 also mandates that um, children or individuals diagnosed with ASD are now going to be under or can be treated as persons with disabilities, along with the necessary provisions, insurances, and all the modifications that are described from Republic Act 7277. And then Section 5 mandates the interagency cooperation, accountability, and research. So ito po yung different various agency ng gobyerno ng Pilipinas to work together in order for to cooperate and also to provide services to individuals that are diagnosed with ASD. Now, Section 9 is very important. This goes back into the recommendation of early screening. So, Section 9 talks about early detection and intervention of autism. So, this specifically mandate the Department of Health and the Department of Education to establish programs for early screening and detection of autism. So, this law actually mandates the Department of Health and the Department of Education in the Philippines to establish screening, to establish detection, early detection of autism, to provide appropriate services in order to provide appropriate services now uh, for the children and toddlers with developmental delays associated with autism, and to ensure that the central PWD registry are updated accordingly. So as early as children, when they are screened and diagnosed with ASD, that appropriate services will be provided at an early age. And also, since they will be treated as part of Republic Act 7277, that they will be registered under the PWD and will be updated accordingly. And then for section 12, this follows up with what are the provisions from the law? Ano po yung nakasaad sa batas na to help persons with that are diagnosed with ASD. So ito po yung insurances that would shoulder funds for their medical expenses like occupational and physical therapies. So ito po yung nagsasaad na they should be covered. It is mandatory that they should be covered with insurance and, of course, protected from discrimination. So, ito po yung specifically the law states that they will be covered under the National Health Insurance Program of the Philippines. So, meron na po tayong batas in the Philippines that caters or that um, that caters and care for individuals that are diagnosed with ASD. All right, and I will give the link. I will provide you with the link for the copy of the Republic Act 10754 under the description. All right, so meron na po sa Pilipinas, but how about those that are living abroad? So, who can formally diagnose autism spectrum disorder? So, alam natin sa Pilipinas that there is a law already. So, in the United States, typically they are the pediatrician. So, to review, here in the United States, this is now mandatory for pediatrician to screen for ASD uh, at 18 months and then at 24 months. So, ito po yung child neurologist, psychiatrist, and psychologist. So, in the Philippines, according to the law and also tahanan ng pagmamahal as of 2025, that in the Philippines, these professionals that can conduct assessment for autism spectrum disorders are developmental pediatrician, child neurologist, child and adolescent psychiatrist, and also child psychologist that has expertise. So hindi po lahat ng mga medical professionals ay expert. So there should be some medical professionals that are experts on this field. In the United Kingdom, formal autism assessment is conducted by a multidisciplinary team. So it is a group of professionals like again, pediatrician, psychiatrist, or neuropsychologist for children. Ito po'y base sa National Health Service or NHS. Now, sa United Arab Emirates, um, several types of professionals can conduct. So, hindi po multidisciplinary. So, several professionals like the Philippines, any medical professional that has expertise in ASD can perform the assessment. So this includes clinical psychologists, psychiatrists, developmental pediatrician, child neurologist, and specialists in early intervention program. So as you can see the commonalities here, it always goes back into the pediatrician. So if you were a parent and you are noticing some symptoms of ASD. So, mas mabuti po to tell your pediatrician or to ask your pediatrician for screening to make sure that these symptoms are not related to ASD, or if they are related to ASD, that you get a formal diagnosis to be able to access supports and services that are provided by the government and also from provider networks. And in Australia, again, it's the same thing. It is professionals that are allowed to assess ASD are those pediatricians, psychiatrists, psychologists, and speech pathologists. So it's worldwide now. Any of these countries, leading countries, have their own way, but there is a commonality that there should be individuals or professionals that are experts or has experience with ASD. So, so Pilipinas, if you go and visit your child doctor or your pediatrician, to ask them if they can assess ASD because of the symptoms that are manifested ng mga bata, or ask if you can be referred to a professional that is an expert in ASD screening. At ito po ay nakasaad sa batas. There is now a Republic Act that mandates early screening. So, this is what we are discussing now. We are discussing the introduction to ASD and now early screening, the importance of early screening, and also the laws and provisions that mandates that supports early screening of ASD. So, up next, now that we have all the ideas and informations about what are the symptoms, what do we need to look for, and how to get a formal assessment in order to get the necessary services according to the law. In our next topic, we will be looking at identifying your support network. Ano po ba yung mga professional after the diagnosis that are available in your area, in your community, that could become part of your support network? Kasi po, in the Philippines, the law tells us about agency. It's interagency that works together in order to help and support individuals with ASD. And then research-based. So ito po yung sinasabi kong research-based behavior modifications. So we will look at the research-based modifications and how can we apply it at home? How can we use this research-based behavior modification at home? And then we will also talk about early interventions at home for skill building. So alam natin there are developmental delay, and I remember one of my professors said that once a child is assessed or diagnosed with ASD, then we have a job to do. So we have a job to do at an early stage. So it's very important that a child should be assessed at a young age so that we can start the intervention, we can start the skill building. Alam natin kung saan natin pwedeng turuan, alam natin kung paano natin turuan in order to help them achieve their full potentials and also improve the quality of life as they grow up. And if you have any questions or if you have any topics that you want us to look at or research, please let me know and add it on the comment section. All right, so that's all for today. And thank you very much for taking time in watching this video. And I hope that I was able to share, I was able to help you understand better about ASD and the importance of early detection and also early intervention.